Okay, so what I'm doing is I'm going to check the different structures on your body.
Okay.
A structure like you hurt your knee.
Uh-huh.
We're going to analyze to see if your knee is rotated in or out first.
Okay.
Okay, so a way to do that is I already analyzed your feet before
Right.
to see if your feet are going to align or they're going to shorten. So
Okay.
what we're going to do is we're going to check your alignment. So I'm going to have you muscle test your strength
Okay.
in your arm by
Okay.
checking different places down here to see
Oops.
how they impact you.
Okay.
So hold your arm very strong. Okay, that's your normal strength.
Okay.
So I'm going to push in, hold strong. Okay, no change in your strength, right?
No.
Okay, now if I push out, hold.
Ooh.
Feel the difference?
Wow. What's that got to do?
It has a lot to do with it. So when your nervous system is impacted because of a mechanical problem somewhere else in your body, all the muscles in your body also go weak as a result of that.
Awesome.
So we're actually analyzing to see if your legs rotated out.
Okay.
It was. Okay.
My knee.
Your knee is rotated out this way. So your tibia is rotated over your fibula. So now what we're going to do is we're going to rotate that back. And so it's a very gentle manipulation.
Okay.
And that's what it feels like. That's it. Okay.
That's it?
That's it. So now I'm going to check the same thing.
Okay.
I'm going to grab the knee.
Hold it tight.
Okay, hold it tight. I'm going to push out again. Hold.
Okay.
Feel the difference in your strength?
Yeah. Was that the one that went right down
Exactly.
before? Wow.
Yeah. So it makes a big difference.
Wow.
So we're going to check other spots on your body as well. Okay.
Okay.
So there's other spots in your body that could be reacting to places that are weak, causing some sciatic problems as well.
Okay.
So remember we talked on your x-ray about the pubic symphysis?
Yep.
So I'm going to push on that area. And that side didn't go short, so it stayed balanced. So now I'm going to check this side, and there's an imbalance there. So I'm going to have you help me here.
Okay.
You're going to take your thumb, you're going to push it on that side.
Okay.
Okay. Hold your arm very strong. Okay. That's good, right?
Yeah.
Okay, it's strong. Now watch what happens. Push on this side, hold strong.
Yeah.
You can't hold that. So,
amazing.
So we're going to move this part of your pubic symphysis and this. Now push on that side again. So it's changing your nervous system to change the position of your joints and how your nerves are sending information through your body.
Oh my God, that is so cool.
Pretty neat, huh?
Oh, yeah.
Okay. So we're going to check a couple other spots. This is your motor cortex of your brain.
Okay.
So we're going to check some areas of your skull. A lot of people have skull misalignments that cause problems between their brain and their central nerves that come through their spinal cord out through the periphery. So in other words, your central nervous system is your brain and spinal cord. When that gets compromised, then the messages can't be received to other parts of your body. Wow. So we want to make sure that's also turned on. So what we do is we analyze it in different positions.
Okay.
And so I just checked your frontal bone up here, this direction. We're going to check that direction. Okay. So, and that is a problem. We're going to check one more part of your frontal bone, which is lower in your face, and that's a problem. So if you take your finger like that and you put it right here.
Okay.
Okay, and you bring your arm up.
Push on.
Hold very strong.
Push on my forehead.
Hold strong. You're strong, right?
Yeah.
And you would think nothing should change if you move your finger to there, right?
Right.
Hold strong.
Oh my gosh.
You can't hold that, right?
That's so wild.
Okay. So now if I treat this and I move those parts of your plates of your frontal bone back into position and you put your finger back there.
Right here?
Well, that's where you started, right there. Hold strong. Okay. And now bring it down. Hold strong. Feel the difference?
Oh, yeah.
Okay. The big difference.
Amazing.
Already. So we're treating different parts of your skull as well, because then your messages can be received through your body properly.
Okay.
Does that make sense?
Yeah.
Okay.
Wow.
Good.
I love
Thank
it.
you.
It's all